Good morning, and thank you for joining us. I'm pleased, as always, to be joined by Dr. Lawrence Lowe, Peel's Medical Officer of Health. And before I give my update, I wanted to first acknowledge those who are celebrating Hanukkah and Advent in our community. On behalf of the city, I join you in marking these important celebrations. May this time of meaningful reflection bring you hope, comfort, and joy. This week has been nothing short of incredible for our city and for our future. Yesterday, I had the pleasure of joining Premier Ford, Minister Elliott, and the leadership team at Trillium Health Partners, and as well as our former Mayor, Hazel McCallion, and our local councillors and MPPs, as the Premier announced a transformational multi-billion-dollar investment to build a new state-of-the-art Mississauga hospital. It's a well-known fact that Trillium Health Partners will experience more demand for services than any other hospital over the next 20 years, 7 times more than the average hospital in the province. And while the team at Trillium Health Partners has done so much for our community throughout this pandemic, it has frankly brought to light some of the real limitations and aging technology at the Mississauga site. The redevelopment of the hospital will not only increase capacity and reduce wait times, but it means Mississauga will soon be home to one of the largest and most innovative hospitals anywhere in Canada. Speaking of hospitals, Trillium Health Partners have been critical in the fight against COVID-19. And while they are in a good shape right now, an uptick in cases could threaten the capacity of their critical care systems. As many of you have heard, a new variant, Omicron, has surfaced in Ontario and several other provinces. While no cases have been identified yet in Peel, there is still so much we don't know about this new variant, which means we must stay strong and stay the course. We cannot afford to go backwards. The most prominent strain in Peel remains the Delta variant, and we know the vaccine is effective against it. Achieving the highest vaccination rates possible remains our key defense against this virus. I want to thank the 86% of Peel residents 12+ who are double vaccinated. We are narrowing in on our target of 90%, and I encourage anyone who has yet to get vaccinated to please go out and do so. I'm equally as encouraged that over 9,000 children ages 5 to 11 have received their first dose. Appointments are still available, so please book today. Which brings me to booster shots. If you are eligible for a booster, please book an appointment. I'm pleased to hear in media reporting that we are expected that the age of the booster shot eligibility will expand to 50+. Minister Elliott will have more to say about this very soon, and as the province plans to expand third doses in light of this new variant. This is especially important as we officially entered the season of holidays, family gatherings, and year-end celebrations, which also means flu season is upon us, unfortunately. Seasonal flu shots are now available to all residents in Peel, and I encourage you to get one. In just a few minutes, in fact, Dr. Lowe will be giving me the flu shot. And while it will not protect me from COVID, it is often mild, and in some cases the flu can have serious complications and result in severe illness or even death. Please, don't take any chances with your health. Reach out to your healthcare provider to confirm availability of the flu vaccine. Before I call Dr. Lowe to the podium, I'd like to ask for his assistance and that of Sharon Lee Chan, our occupational health consultant and RN, in helping me get my own flu shot. Shall we, Dr. Lowe and Sharon? And I got a treat, too. Thank you so much. I'm very thankful to have this added protection today. And now I would like to invite Dr. Lowe up to the podium to provide his update. Dr. Lowe, over to you. Thank you.
Thank you, Madam Mayor, and good morning. And I do want to start by thanking Mayor Crombie for her continued leadership and for getting her flu shot today. Flu season is here, and the flu shot is added protection against illness and an old foe. You can book your appointment at your local pharmacy or through your primary care provider or physician. Regarding COVID-19, this week in Mississauga, our cases stand at 23.7 per 100,000 with a test positivity of 2.6%. 86% of our residents over 12 plus are now vaccinated with 2 doses. And as Madam Mayor noted, in the past week, we have now managed to offer first dose protection to 9,100 children aged 5 to 11. Together with our local health unit partners across Ontario, Peel Public Health continues to monitor the emergence of the Omicron variant. It is still early days, however, and our understanding of the implications of this variant continue to evolve. Even as we await further information around the Omicron variant, however, vigilance and vaccination remain our best defenses against COVID-19. I want to urge my fellow parents of children aged 5 to 11, please start your child's vaccination journey without delay. I have been so relieved to see some of our young, brave faces in our clinics rolling up their sleeves to get their first dose and start their journey to protection against COVID-19. The sooner we all get our children vaccinated, the better it will be for all of them and for our community as a whole and your family. All of our clinic offerings, both at our large sites and in our mobile settings out and about in the community, have been set up to be family-friendly. Our staff have been trained specifically at ensuring that the experience is both positive and safe for your child and for your family. You can visit peelregion.ca/COVID-19 vaccine for further information on where you can get your children protected. Recent analysis from the Ontario Ministry of Health is clear that the benefits of vaccination far outweigh any side effects that might arise. While children up to now were thought to mostly experience mild illness with COVID-19 infection, it's clear that Delta is different. In recent months, statistics show that up to 1 in 25 children who contracted COVID-19 reported prolonged symptoms consistent with long COVID after the acute infection had cleared, and that of the nearly 200,000 children aged 5 to 11 that have been infected with COVID-19 across Canada throughout the pandemic, over 1,000 have been hospitalized, with many of those hospitalizations arising in the most recent waves. That's 1,000 kids too many. And as a scientist, I know that the disease remains novel to so many, including our children aged 5 to 11. And that's why we're all still trying to understand what makes certain kids more vulnerable to more severe outcomes than others. But as a parent, though, I can't stress enough, why risk the potential anguish of seeing your child sick or in a hospital bed? Please, take steps to vaccinate your children and provide them with the best protection from experiencing a severe course of COVID-19. The vaccine is first and foremost about protecting children. It's the best decision you can make for your child with Delta circulating and with our uncertainty around Omicron. It also provides certainty in other aspects of your child's interactions, some peace of mind with exposures or outbreaks, especially if they occur in school or in gatherings with family and friends. So I know that this time of year is busy, but getting vaccinated with 2 doses should be a priority for every parent in Peel, and frankly, for all residents that are older than 5 years of age. So if you haven't been vaccinated with 2 doses yet, please book your appointment without delay, and if you are eligible and 6 months since your second dose, getting a booster can also provide you with additional protection. You can find out more information on our clinic offerings at peelregion.ca/COVID-19 vaccine to get your questions answered and to book an appointment to get your shot. Finally, I also ask that in addition to vaccination, you remain vigilant with precautions. As we learn more about Omicron and the current situation that is evolving, continuing to mask indoors in public places where it's possible and also in crowds outdoors, and staying home and getting tested if you're sick also are additional layers of defense to keep everyone safe. Thank you, and I'll pass it back to Madam Mayor.
And thank you. And now, along with Dr. Lowe, we are happy to take any questions from the media. Thank you.
Your first question is from Steve from Mississauga News. Go ahead, Steve.
Mayor Crombie, how are you?
Hey, I'm so very well. How about you?
I'm good. I had a question for you and Dr. Lowe, but perhaps for you and obviously as the mayor of Mississauga, but also as your role on the Peel Police Board. But in a recent report, Toronto's Medical Officer of Health, Dr. Helene de Villa, recommended seeking an exemption from the federal government that would allow for decriminalization of simple possession of controlled drugs, aiming to help stem the ongoing overdose crisis in that city. But we know Peel has had similar issues with drug poisonings. So I was wondering what your stance is on this, and if you would be interested in requesting a similar exemption, and if not, why not?
That's an excellent question, Steve. So certainly we've taken the opioid crisis very seriously here. We're looking at our number of cases, and Peel Regional Police are very prepared with naloxone in their kits should they come across a victim of an overdose. So these are some very serious questions that I know we'll be looking at and analyzing further with the Peel Regional Police Board. And it's also an issue I'd like to discuss with my council before I publicly state a position one way or another. Dr. Lowe, would you like to come forward to the podium? Thank you.
Yes, thank you very much, Madam Mayor. It is worth noting, Steve, that throughout the COVID-19 pandemic response, which is now 676 days in for us at Peel Public Health, harm reduction and opioid, addressing the opioid crisis was one of the few priority services from pre-pandemic that have actually continued. We have continued to work with community partners to engage on implementing the Peel opioid strategy that was released in 2019. And as of the recent announcement out of Toronto, we have re-engaged with other partners around various aspects of that strategy, including studying the announcement by Toronto that they will be pursuing this. We obviously are wanting to make sure that any decisions we make are made in full understanding with the support of our Board of Health and relevant community partners. So we at Peel Public Health at this point in time, we do recognize that many issues with drug and substance use are largely health issues as opposed to criminal issues. But we do want to make sure that we're having those conversations and understanding our specific community context before recommending a major position at this time. Thanks so much for the question.
My follow-ups for you, Dr. Lowe, as well, if you don't mind staying up there.
Sure.
I was going to ask, too, it seems like the provincial government is about to open up booster shot eligibility. I've heard as low as 50 years old. So I just wanted to get your take on, as Peel is obviously doing the youth vaccinations now, and there's been that ramp up, what kind of resources would have to open up, or what kind of capacity does the region have if there was, say, a flood of additional shots that the region would have to kind of facilitate at this point?
So we continue with our fall and winter plan to ramp up our capacity. It's worth noting that in the provincial booking system, the appointment templates for pediatric doses is actually separate from adult doses. So we are anticipating that we will be able to continue making first and second doses our priority. We really do know it's about trying to get protection to this last high-risk, high contact group and making sure that they can access vaccine. That said, as part of our fall and winter plan, we, since the end of October, have been working steadily to double capacity throughout our system. And we understand certainly that, and this was whatever announcement comes out this afternoon, there was always an anticipation that boosters would be coming further down the line, perhaps in Q1 2022, as previously announced by Dr. Moore, even if it shows up earlier. Some of the strategies to increase capacity through primary care, pharmacy, in addition to our growing capacity at our fixed and mobile sites will be engaged. So we are ready, we continue to be ready, and we continue to focus on our priority, which is last mile to 90%, as well as 5 to 11 protection, while awaiting further details about any potential provincial announcement that may be coming. Thanks so much for the question.
Thanks very much. Next question, please.
Our next question is from Declan with Mississauga News. Go ahead, Declan.
Welcome, Declan.
Good morning, Mayor Crombie. How are you?
I'm so well. How about you?
I'm great, thank you. Given the situation earlier this year at Pearson Airport, where a number of passengers were arriving and quickly leaving the airport without taking COVID tests and or quarantining, are you concerned today the same thing might be happening? And are you getting real-time information from airport officials, Peel Police, Health Canada?
So, certainly the situation continues to evolve as we learn more and more about the Omicron variant. Certainly the federal government is continuing to put new rules in place with respect to mandatory testing. And I know that we are staffed up and ready to go so that testing will be and can be done at the airport. And the regulations do continue to change. So as of today, people are required to go home and quarantine until they know that their test result is negative, but we have no other information right now. So the situation is rapidly changing. So I know that they're on deck and ready to react at Pearson Airport, yes.
Go follow up,
Okay.
Declan?
Yes, thank you. Just switching gears, looking at the city's map detailing locations of the automated speed enforcement cameras, it shows as of this morning that 5 cameras are active. Is that accurate at this point? And if so, when would the 22 cameras be up and running?
Yes, so the plan was to have them up and running by the end of the year. There are 5 active with 22 scheduled to be fully activated soon. I thought it was to be by the end of the year, but perhaps it'll take us into the new year to get them all on deck, on board.
Thank you. Our next question is from Natasha at the Pointer. Go ahead, Natasha.
Welcome, Natasha.
Good morning. My first question is about the announcement yesterday. I was at the event and I noticed that it was a little scarce of financial details. So I'm just wondering if you can tell me the city's portion of the project.
So those estimates have not yet been calculated, Natasha. You can imagine a project of this scale, size, and scope. It'll take probably a few years to know precisely what the specs will be, but we know that about 600 new beds will be offered. It'll be a 22-story new, brand new hospital with leading-edge, cutting-edge technology, leading innovation. When we learn more about the square footage and the footprint, we'll know more about the costing and the community contribution. So those numbers are not yet known.
Follow up, Natasha?
Is Chief Rizzi there this morning?
She is not. Is there something we can try to respond to for you?
Possibly. You might have the answer. I was going through the budget as I have been, and I noticed that Station 109 is not mentioned, but in the internal audit that we had obtained, it says it's beyond repair. So I'm just kind of wondering where we're at with that process.
It's best that I follow up with you to get the specific information. That many of our stations are up for renovation, and there are a number of new stations being built that are all in our capital plan. But if you want the exact information on timing of when the plan is for the rehabilitation of that station, I can get that information to you.
Our next question is from Prabjot from Red FM. Go ahead, Prabjot.
Good morning. My first question is for Dr. Lowe.
Certainly.
Dr. Lowe, thank you. Dr. Lowe, insofar, how has been the booster shot uptake in the region among the population? Is there any hesitancy pattern similar to the one that was observed during the first shot?
No, so far we've actually seen quite obviously it was a slow start, but I think folks were just trying to figure out the eligibility criteria. But we have started to see increasing uptake of third dose boosters. I was actually out at visiting the vaccine clinic at Caledon East and saw a number of individuals who appeared to be eligible lining up just at the start of the clinic day. So, I think it really is an important thing, especially with, more indoor time, as well as with new variants emerging. 2 doses does provide a persistent and powerful protection, but we do know that certain individuals may see a quicker, more gradual waning of their immunity, and it is still recommended that booster dose be obtained. So thanks so much for the question.
Prabjot, did you have a follow-up question?
Yes, I have a question for Mayor Crombie.
Yes, Prabjot, I'm here. Thank you.
Yes. So recently the city has made a change in the rental property inspection. So what necessitated this change?
So we just came on board to the similar program that City of Toronto has, the Rent Safe program, to ensure that all our renters are protected and they enjoy the same rights as other homeowners, and to ensure that their residences are safe. And so we will have a pilot project that will allow our inspection team to go out to various rental properties over the course of the next couple of years and do inspections and ensure they are well maintained. And we'll start with a pilot project and then expand it further from there. So we're getting in line with similar programs that are being that are in place in other jurisdictions and other municipalities.
Thank you. That was your final question for today.
Thanks very much for joining us.